you mentioned that we're in flexion. A lot of us are in flexion most of the day. For the viewers out there, flexion means we're leaning forward a bit, yes, bending over more and picking things up, as opposed to extending, which is the good posture we're taught, in school to sit up straight, or in the military, at attention. That is more extension. And that leads me to another point that I try to discuss with my patients is back exercise and strengthening those back muscles and not ignoring them. Talk to me about what simple exercises folks at home might be able to do without even going to the gym to strengthen their back or their core.
Of course. So it's not really just the extension or the back of your back muscles. It's really the whole core as a whole. It's like a cylinder around the spine, and every side of the cylinder needs to be strong. Usually we start exercises doing mobility for the legs and to move the spine through the legs, but then sooner or later we start to get into strengthening using planks, some yoga exercises, little exercises that you could do on your own on a table or on the floor or on your bed that will strengthen up the core from all the sides.
So you're an exercise physiologist by training and education. Let's go over a couple of these exercises that we see in gyms or online. Talk to me about yoga. How can folks out there benefit from yoga?
That's a very good question. Yoga is very beneficial. In some countries, actually, I believe in one European country, Sweden or so, they have a completely different way of treating back pain. So here you end up going to the emergency room, you might get some shots, you might get some medications, then you might get an MRI, and then you might go to a pain specialist or a physical therapist after. In Europe and over there, they try to first do physical therapy, and then they send a person for a two-day-a-week class for yoga for 2 months. And they actually see better results on overall the health of the patient and recovery than we do here. And we spend probably 10 times more money on that same. Yoga is usually doing a lot of extension exercise and core strengthening, so it kind of opposes the daily postures that we spend most of the day in. And it's usually a good thing to do, hopefully about 10, 15, 20 minutes a day on an everyday basis is a good way to do it.
My wife keeps telling me to go to yoga. Now you've convinced me to go to yoga. That sounds fabulous. What about Pilates? Talk to me about Pilates. We see this quite a bit.
Pilates is also another famous way of exercising. It was developed for injured dancers by Joseph Pilates, who created this whole machine that they can use in hospital bed to rehabilitate their muscles and get back to dancing. Now that we see that a lot of people are using it to improve their core strength, majority of the time it's women that are mostly interested in it, but now it's becoming more and more popular throughout. So the guys are getting out of the gym and doing bench pressing all day and trying to figure out how they could do body weight supported exercises. Really, it's the calisthenics that does safe workout of these muscles, and it allows you to progress the muscle strength without getting injured.
So Pilates, yoga, we talked about that, but then there's the conventional gym. For folks and our viewers out there who are thinking about signing up for a gym membership, what are some of the precautions they should take as they go into the gym for maybe the first time ever or the first time in decades? What are some of the precautions that they need to know about before starting a new workout regimen?
So the gym is a good place for people to get fit, but it also could be a dangerous place. So we tend to go to the gym and see what other people are picking up and the exercises they're doing. So they end up picking up weights that people have been doing for maybe 2 years, and this is your first time doing it. So a lot of times people get sore, they get injured, they never want to go back to this doing the exercise. The number one thing I always recommend is if a person feels pain during the exercise, don't do it. There's other ways of stimulating the same muscle, figure out different techniques, because if you keep doing it and doing it over, you're going to injure the muscle and possibly cause tendonitis or a rupture of a ligament or a tendon.
So we talk about muscle injury, and in the gym, properly guided patients or gym members, as they're starting their workout, it's really what we're looking for is a controlled muscle injury, where we do the right form, we follow the right instructions to avoid a muscle injury or even worse, bony injury, tendon injury. So when folks go into the gym, they start out, they're under a good regimen, and they feel something wrong. You mentioned stop. What if that continues? Next step, they come and see their physician or physical therapist. Tell me how, if someone develops elbow discomfort, we know about tennis elbow or golfer's elbow, how can you manage an injury like that conservatively in your practice?
So any sports injury usually goes under the RICE protocol, so rest, ice, compression, elevation. We all kind of try to follow it. But majority of the time, icing it is very important initially. Of course, you want to rest it. You don't want to continue using it. And then you want to do something to improve the muscle strength around the muscle, around the joint, so that other muscles take on the job and not the injured muscle itself. But really, the key is using lightweight. Lightweight, high repetitions is always safer than doing some heavy one repetition max exercises.
Like the commercial we see of the large gentleman saying, I pick things up and put them down. That is not the goal when we ask patients to start exercising. I like what you said about starting low, high repetitions. And the RICE protocol, R-I-C-E, is important for patients to remember. Always speak with their physician or their physical therapist when they get an injury. So if a sports-related injury occurs for our athletes watching today and they speak with their physician, they come to see you in the office, and unfortunately, physical therapy just isn't helping them. They start taking medications. What have you seen people on in your practice for pain?
So majority of the time, they usually start them off with non-steroidal anti-inflammatories. Sometimes people go into the muscle relaxant category too, if there's a spasm in the muscle that's severe. At times, people will go to the pain medication. Unfortunately, the pain meds have a very high rate in our country. So we usually, now the current research shows that it's better to stay with the anti-inflammatories and use some sort of, for low back pain, a lumbar support or a belt device or something to kind of keep the proper posture in the muscle without having to take so many medications. Of course, sometimes we also recommend people to undergo steroid injections with their pain management, because usually if the pain doesn't go away within a month or so, then we usually recommend for them to do something else, and that involves the shots. And if they do, can prescribe also heavier medications.
And you mentioned some of these support devices. So if someone's in physical therapy but needs some extra help, I've seen folks walking around with various belts on and straps. I see the devices wrapped around the elbow. I've seen them wrap around the lower leg. What are some of these devices that you are using or your patients are using, and how do they work?
So it's a good question, because these devices actually provide pain relief and they provide comfort for the person to maintain their day. So usually a person gets injured, they end up unable to maintain their day-to-day routine, but they still have to. So it's for those people that have kids and they still have to pick them up, or they still have to go to work, or they still have to cook and clean to maintain their day-to-day routines. It's usually a device that's made out of Velcro, some hard plastics. Sometimes they use metal stirrups in it, and also kind of a material that holds it all together. Usually they're required to wear this for the first couple of weeks while they have the injury, and then if it comes back or gets worse at any time. But we also don't want patients to get used to these devices, because they can end up causing atrophy to the muscles. The muscles get weaker when they don't do the job that they're meant to do, and actually people get dependent on these devices. So there's a good and a bad with these.
And when we combine physical therapy, sometimes the anti-inflammatories that you mentioned, and folks get better, we like to discontinue the medications as soon as possible. How often do they need to follow up with you, or do you just leave them with the education to move on in the gym or do home exercises? Are they tied to a physical therapist for life, or are they able to move on and maybe do corrective action and continued exercise on their own?
So majority of the time, we see them for the first month. So in the first month, we try to teach them the ways to deal with their pain, the do's and don'ts for them about their pain, and then also how they prevent it later on in life. Majority of the time, it will come back. So for back pain, they say on the first or second year, about 80% of people will have that back pain reoccur. So they just need to learn and have some kind of a routine that they do for the pain. So that way they are more in control of it, and they're not, disabled and not unable to keep up their day-to-day.
And they should come back to you again if they develop the same discomfort. They should come back and seek physical therapy again, because if the exercises or the maneuvers that you do to help them stretch or build their muscles back, if it worked the first time, there's hope for a second time that it can help again?
Well, we always try to educate them more than just do, because I don't want to just do something to a patient and they only feel relief from me doing it. I want to teach them how to do it themselves, and that they will be in control of it. So majority of the time, if the back pain came back and they're not able to treat it on their own, or it's a worse episode than normal, then of course they should come back to us to maybe see if it's something gotten worse or if something is not the same as it was before. Sometimes they require to undergo medical imaging, and sometimes they need other healthcare professionals to be involved as well.
So it's important that if the education and the maneuvers, the exercises you provided them with, if they stop working, to come back and see you. What I see a lot in practice, unfortunately, is that patients turn towards these terrible pain medications. And we know that America is the #1 prescriber in the world of opioids, which is a tragedy. It's a tragedy. And so I want the viewers out there to be aware that from your standpoint as a physical therapist, if the pain is coming back, they should come back and see their physician, come back and see their provider, as opposed to turning towards some of these harmful medications. Let's touch a bit upon surgery. Folks go for a surgery after they had an injury. Maybe physical therapy wasn't enough, exercising the muscles around the injury didn't help enough, and this is going to be an issue that needs surgery. Folks go for an operation with a talented orthopedic surgeon or whoever it is they have to go to. Post-op. Are you guys back in the picture post-operatively?
Yes, yes. We are in the picture because we want to show the patient what to do after the surgery so that they're feeling more in control and they can actually do their regular day-to-day quicker. They've shown that physical therapy actually improves the healing response, and the patient is able to get back to their normal day-to-day a lot faster.
We see that in all sorts of surgeries, actually. Even with gastroenterology, when we send folks for colon surgery, the data shows us now getting out of bed immediately, getting moving quickly, improves outcomes. And so you're seeing the same when it comes to orthopedic procedures or for injury procedures, I guess. Is that correct?
Yeah, when I worked in the hospital, there was actually an order to get the patient up the same day, and they're usually supposed to get out of the bed and walk around on day 2 for sure. So usually the quicker they get moving, the more the muscles start to work, and they start to take the job of the place that was injured or cut or whatsoever.
That's great. I agree. A body in motion stays in motion. Folks need to get out of bed, keep walking around. It helps. And you're saying with orthopedic surgery, you were getting them out of bed right after and moving them around. Same we see here with gastroenterology, folks who have their colon surgeries. A body in motion stays in motion. And it seems like you are keeping people in motion in your practice. For folks watching today, how could they find you?
I'm located on 201 Kings Highway. I'm working in IDCC. It's a multi-specialty clinic. We are located on West 11th and Kings Highway, and our phone number is 718-621-1811. We have cardiologists, primary care, neurologists, OBGYNs. We have speech.
Everything
PT,
you need is under one roof.
Yeah.
But the most important thing, in my opinion, right now is having a good physical therapist.
Yes.
In this country, we see folks who suffer from pain unnecessarily. And for our viewers today, if they're having any of these symptoms, of course, the first step is to go see their physician. And they may end up with a physical therapist like you, well-trained, able to keep folks moving. And that's just so important for our viewers today to know. First step, a good open conversation with their physician. Thank you so much for joining us today. I think your words of wisdom will have a great effect on our viewers, and I'm happy that you were here to join us today.
Well, thank you so much for having me. I had a pleasure talking to you about this important issue. And if people ever want to contact us, feel free to call us, and we'll definitely try to help them out.
Thank you.